You take your medication faithfully every single day, you follow the meal plan, you measure your portions, you walk every morning, and yet your blood sugar numbers are still unpredictable. One morning it is acceptable, the next it is 20 points higher with no clear explanation. You have done everything right and it is still not working the way it should. I need you to consider something you have almost certainly never been told. The problem may not be what you are eating or how much you are moving. It may be something far simpler and far more overlooked than either of those things. If this channel has ever given you something worth keeping, hit that subscribe button right now, leave a like, and drop a comment below, because that is what allows this kind of conversation to keep reaching people who genuinely need it. I'm Dr. Mercer, and this channel exists to bring you the latest evidence-based research on senior health. Simplified and designed for adults over 60, stay with me through this entire video, because by the end you will have a specific, practical method that my patients have used to reduce their fasting blood sugar by an average of 20 to 30 points, without changing their medication, without a new diet, and without anything that costs more than what is already in your kitchen. Let's begin with the problem that almost nobody in this conversation is naming clearly. After 60, several significant physiological changes occur that make blood sugar control genuinely harder. Even when you are doing everything your physician has asked, your cells become progressively more resistant to insulin, meaning they do not respond as efficiently when insulin tries to deliver glucose into them for energy. Your pancreas produces insulin less effectively than it once did, so you are working with a smaller supply of a hormone your body depends on. Your kidneys filter glucose less efficiently, meaning excess sugar stays in your bloodstream longer than it should. And here is the piece that even many healthcare providers miss. The brain's thirst mechanism becomes significantly less sensitive with age. That last point is critical. You can be meaningfully dehydrated without feeling thirsty. Your mouth may not feel dry. You may notice no obvious discomfort, but at the cellular level, something is going wrong. Research published in the journal Diabetes Care found that even mild dehydration of just 2% below optimal hydration levels, a level most adults over 60 would never notice subjectively, can raise blood glucose by 10 to 15 points. 10 to 15 points, that is enough to take someone from reasonable control to poor control. That is the explanation behind those frustrating morning spikes and unexpected afternoon highs that seem to come from nowhere. A study from the European Journal of Clinical Nutrition, which followed over 3,000 adults over a period of 9 years, found that participants who drank fewer than 500 milliliters of water per day had a 59% higher risk of developing elevated blood sugar compared to those who were adequately hydrated. 59% higher risk from something as fundamental as how much water you drink each day, and yet hydration is almost never the first conversation in a diabetes management appointment. Now let me walk you through the specific ways dehydration quietly works against blood sugar control in older adults, because understanding the mechanism is what makes the solution feel real rather than arbitrary. The first mechanism is blood viscosity. Think of your blood as a river carrying glucose to cells throughout your body. When that river is full and flowing well, glucose moves efficiently to where it needs to go. When the river runs low, it becomes thicker and slower. Glucose accumulates in the bloodstream instead of being delivered. Insulin is present but struggling to move efficiently through blood that has become too concentrated. I had a patient I will call Gerard. He was 68, took his metformin without fail every morning, walked 5 kilometers a day, measured every portion of food. He brought a notebook filled with blood sugar readings to every appointment, same breakfast every single day, steel-cut oats with a measured portion, and yet his morning numbers varied by 30 or 40 points with no pattern he could identify. When I asked him to walk me through his morning routine in detail, the answer became clear. He woke at 6:30, checked his glucose, made coffee, read the news, and did not drink any plain water until he took his medication at 7:30. That meant 9 consecutive hours, 8 hours of sleep plus 1 hour awake, without any meaningful hydration. We made one strategic change. Before his coffee, every morning, he drank a glass of warm water with a small pinch of natural sea salt and the juice of half a lemon. 14 days later he called my office. His morning readings have been between 125 and 138 every single day for a week, a consistency he had not seen in over 2 years. A month later his average fasting glucose had dropped by 22 points, no medication changes whatsoever. The second mechanism is what happens when dehydration disrupts the morning cortisol response. Every morning your adrenal glands naturally release cortisol, your primary stress hormone, cortisol signals the liver to release stored glucose into the bloodstream to prepare your body for the day ahead. This is a normal biological process. But when you are dehydrated upon waking, that cortisol spike becomes exaggerated. The liver releases more glucose than necessary. Your blood sugar rises before you have eaten a single thing. This is one of the key drivers of what many patients with diabetes call the dawn phenomenon, that inexplicable morning elevation that does not correspond to anything they ate the night before. Proper hydration upon waking, with the addition of a small amount of electrolytes and a mild acid like lemon juice, has been shown in clinical observation to calm that adrenal response and reduce the unnecessary morning glucose release. The third mechanism concerns what happens around meal times, when you drink a moderate amount of water. Approximately 15 minutes before eating, you prepare the digestive system, stimulate enzyme production, and slightly dilute the stomach contents. This directly slows the rate at which carbohydrates are absorbed into the bloodstream. When carbohydrates enter the bloodstream slowly, your available insulin can keep pace with demand. Blood sugar rises gradually rather than spiking sharply. Clinical trials examining pre-meal water consumption found reductions in post-meal blood sugar spikes of up to 20%. That is often the difference between manageable control and consistently elevated readings after every meal. Before I give you the specific method, I need to say something clearly and without softening it. Nothing in this video is a reason to stop your diabetes medication, reduce your dosage on your own, or make any change to your treatment plan without your physician's knowledge and direct supervision. What I am describing is a supportive strategy that helps your existing medications work more efficiently. It is not a replacement for medical care. If you have kidney disease of any kind, speak with your physician before significantly increasing your daily water intake, because your kidneys process fluid differently and your hydration needs must be individually assessed. If you take blood pressure medication, be aware that improved hydration can naturally lower blood pressure, which is beneficial, but may require a dosage review with your physician if you begin experiencing dizziness. Always report any new symptoms to your doctor promptly. Now, what does the evidence support as the most effective approach to hydration for blood sugar management in older adults? The method I use with my patients is built around 3 specific timing points and 3 essential elements that determine whether the water you drink actually reaches and hydrates your cells or simply passes through. The first and most important timing point is the moment you wake up. Before coffee, before breakfast, before anything else, drink 1 full glass of warm water, approximately 350 milliliters. Add a tiny pinch of natural sea salt, the amount that fits on the tip of a small knife, and squeeze in the juice of half a fresh lemon. The sea salt provides sodium, potassium, and magnesium. These are the electrolytes that help your cells actually absorb the water rather than allowing it to pass through unabsorbed. The lemon provides a mild acidity that helps stabilize the blood sugar response to your first meal. Together these additions turn a simple glass of water into a targeted morning intervention. The second timing point is 15 minutes before your main meals. Drink 1 small glass of room temperature water, approximately 150 to 200 milliliters. This is the pre-meal habit that slows carbohydrate absorption and reduces post-meal glucose spikes. It takes 15 seconds and costs nothing. The third timing point is approximately 1 hour before sleep. Drink a final glass of warm water. For patients whose physicians have confirmed it is appropriate for them, dissolving 200 milligrams of magnesium citrate or magnesium glycinate into this evening glass adds a meaningful additional benefit. Magnesium is essential for insulin function and the majority of adults over 60 are deficient in it. Taking it before sleep supports both overnight blood sugar stability and deeper, more restorative rest. I want to tell you about a patient I will call Dorothy. She was 74. Had been managing type 2 diabetes for 19 years, understood carbohydrate counting better than most nutrition specialists, and had done everything her physicians asked. Her hemoglobin A1C had reached 8.6 and her endocrinologist was beginning to discuss insulin therapy. She told me she felt like she had completely failed after nearly 2 decades of trying. Her daily water intake when we reviewed it was 3 or 4 small glasses, often mostly coffee and tea. She never felt thirsty, and she avoided water in the evenings to reduce nighttime bathroom visits. We implemented the method described above. 6 weeks later her average glucose readings had dropped from a range of 185 to 205, down to a consistent range of 145 to 165. 3 months later her A1C came back at 7.3, down from 8.6. One of her medications was reduced under her physician's supervision. She told me she had energy again for the first time in years, and had returned to gardening, something she had given up 2 years earlier. Here is exactly what to do with what you have just heard. Step 1. Starting tomorrow morning, drink 1 glass of warm water with a small pinch of natural sea salt and fresh lemon juice before your coffee or any food. Do this every single day before anything else. Step 2. Set a reminder on your phone or place a glass of water on the table 15 minutes before you normally eat lunch and dinner. Drink it before you sit down to eat. Step 3. At your next physician appointment, ask specifically whether your current A1C trend could be influenced by chronic mild dehydration, and ask whether adding magnesium citrate to your evening routine would be appropriate for your kidney function and current medications. Step 4. Track your morning fasting glucose for 14 consecutive days. While implementing this method, write the number down each morning. Bring those 14 readings to your next appointment as concrete data for your physician to review. Step 5. Calculate your approximate daily water target using this simple formula. Take your body weight in kilograms and multiply it by 35. The result is your approximate daily water requirement in milliliters. Spread that total across the day in small consistent amounts rather than large volumes consumed all at once. Your body can absorb approximately 200 milliliters every 15 minutes. Drinking more than that at once does not increase absorption. It simply increases bathroom visits. One important clarification before we close: this approach produces its most meaningful results in patients who are currently managing blood sugar through lifestyle, oral medication, or both, and whose readings are inconsistent or higher than their care team would like. It is a supportive strategy, not a primary treatment. If you are already well controlled with stable readings and a satisfactory A1C, this method may still support your overall health but may produce less dramatic numerical changes. Additionally, if you have been told by your physician to restrict fluid intake for any reason, whether cardiac, renal, or otherwise, those instructions take absolute precedence. Do not override medical guidance based on anything in this video. Your blood sugar numbers are not just numbers, they are a daily measure of how much energy your body can access, how clearly your mind can function, and how freely you can live the life you have built. Dehydration has been quietly interfering with all of that, not because you were careless, but because nobody told you it mattered, or how to address it. Now you know. If this video gave you something useful, hit the like button right now, leave a comment telling me whether you are going to try this method starting tomorrow, and share this with someone you love who is managing blood sugar and still not getting the numbers they deserve despite doing everything right. Subscribe if you have not already, and I will see you in the next one. Take good care of yourselves.